Hello, everyone. How are you doing? Thank you for being in the seminar today, for attending. We have a really wonderful session planned for you today. Just wanted to kind of introduce our speakers. We'll be talking about bridging the gaps in wheelchair provision in global settings and also thinking about the AI technological advances for future wheelchairs, as well as kind of offering some commentary on the state of the art and where things are at this moment. I want to introduce our speakers. I'm going to introduce them all, and then they'll come in, and the way the seminar will be, they'll all do set of presentations. There'll be 3 sets of presentations. Please remember that you can put your questions in the Q&A, and we'll take those after all the speakers have gone through. So we're going to get started. So our first set of presenters are coming to us from South Africa. It's Maria Brits. Maria and Ronique are together. They'll be presenting together. Maria is a seating practitioner at Shoniquip Social Enterprise, specializing in wheelchair and assistive device tech. She has a nursing background and postgrad training in disability practice. Ronique Walters is a physiotherapist at the same location. She specializes in assistive technology and provides a clinical services, conducting training and conducting research. And they'll be talking about disability inclusion in the Northern Cape, and they'll be sharing their insights there. Our next, after they shared, our next presenter would be Dominic Vorshkovitz. And Dominic is coming to us from ETH Zurich, and he is a doctoral student in the Spinal Cord and Artificial Intelligence Lab. And his research has been focusing on kind of developing the next state of the art of wheelchairs and where are we going there. So he'll talk a little bit about what he's been doing in his work and how these types of smart technologies might transform what the future of wheelchairs could look like. And then we have Prithika Kandaville, who's coming to us from the International Society of Wheelchair Professionals, and she is on staff at the society, and she holds a bachelor's degree in computer science, and she'll be talking to us, maybe making comments on what she's heard in terms of the previous presenters, but then also talking about what's going on in their society to make wheelchairs global. So with that introduction, I am going to pass I'm going to stop sharing my slide and pass the share to our colleagues over there in South Africa to do their presentation. Please go ahead. I'm going to turn off my video. So.
Hi, good afternoon. It's actually afternoon here. We're in South Africa. I'm Ronique and
I'm Maria Brits. I'm a clinical colleague working at Shoniquip and doing seating.
Nice to be with all of you. We thought we would start by telling you a little bit about our organization. So the Shoniquip Social Enterprise was started by the parent of a person with a disability. Shona McDonald started Shoniquip roughly 38 years ago. And the reason that she founded the organization was her daughter, Michelle. Michelle was diagnosed with cerebral palsy when she was born. She's 41 now. And at the time that she was born, there was very little or no assistive devices or assistive technology that was appropriate for children with intermediate and advanced posture support needs available in South Africa. So Shona decided to work together with the biomedical engineering department at the University of Cape Town. She herself is a sculptor and a designer, and she designed Michelle's first motorized wheelchair. After she designed Michelle's wheelchair, she discovered that Michelle's mobility wasn't her only barrier within her community, and that she faced attitudinal barriers to accessing education, barriers to accessing healthcare in South Africa. And for this reason, she altered the way that Schonequip works and decided to make it a hybrid social enterprise and established the Yohambo Foundation. So the Yohambo Foundation looks at upskilling and capacitating parents, local community members, social workers, teachers in how to stimulate a child with a disability and how and the various barriers that people and children with disabilities face. She also further developed the organization by establishing the Parent Champions for Change Trust, which is owned by parents, and it really helps the organization direct their work and keep connected with what is needed and wanted by parents in the field. So this evening, we'd like to share with you the aims and the outcomes from a project that we led in the Northern Cape in South Africa. The project was a pilot study that we conducted together with the local Department of Health and a local mining company. So the aim of the study was to implement mobile outreach seating services in the Northern Cape in South Africa. The need for the study was, or the project was actually identified through a local mining company called SIOC, who had identified that there were children with disabilities in their community. Some of them were children who were children of the employees of the mining company, and they wanted to improve the access and ensure sustainable service delivery, wheelchair service delivery in the province. So they approached Schonequip and the Northern Cape Department of Health and asked us to work together with them to mitigate this problem. The objectives for the project were to capacitate local therapists to deliver quality wheelchair services in local communities in the Northern Cape. Because therapists are the rehabilitation specialists and they will be the ones who will most likely ensure that the project is sustainable, we wanted to work directly with them. And then we also wanted to create an awareness about the barriers to inclusion faced by people with disabilities. Because Northern Cape is quite a rural community, there's a lot of shame and exclusion that people with disabilities face, and we wanted to ensure that we address the overarching barriers to inclusion as well. For those who aren't familiar with the Northern Cape in South Africa, it's a very dry province. It's the largest province in South Africa. Road maintenance specifically is a huge challenge, and there's also limited access to modern transport. Limited access to healthcare is also a big challenge for the people living in the community. I think there is one tertiary hospital in the main city in the province, in Kimberley. It has a total population of 1.3 million people, and estimated there are 144,000 persons with disabilities and between 3,500 to 30,000 children with disabilities. For the project, we decided to adopt a hybrid approach. So we did in part remote training with therapists, and then we also had a practical component that we did as site visits. The online training we conducted over WhatsApp and Zoom, and we trained 40 therapists in 2 clusters in the Northern Cape. On-site training, we did practical sessions in person with therapists, and that we did across 17 towns. The purpose of the training focused on delivering the World Health or teaching the therapists and upskilling them in terms of the World Health service steps and guidelines. So they learned about assessment, prescription, product preparation, fitting, user training, and of course, how to maintain. Additional training that we provided was disability awareness training, which we call our Let's Talk Disability Workshop, which brings together various people from different parts of the community to talk about disability. We also developed our own impact tools. So the first impact tool that we developed was the Competence and Confidence Questionnaire. It was a survey that we submitted to therapists after the first visit and the follow-up to compare how much their awareness has raised from the initiation of the training to the follow-up visit. Therapists were scored against the various World Health Organization criteria. So once they received the questionnaire, they would score themselves according to how well they thought they were able to assess, prescribe, fit, follow up, etc. And then our clinical team at the SSE would then review their scores and score according to how they observed the therapist in the field and during the online training. In most cases, we saw that the therapists scored lower than what they had initially scored themselves. And this was mainly because our clinical team felt that there were still key components that they were missing that needed further training. Therapists' feedback was quite positive, the Northern Cape therapists, and they felt that they enjoyed the sessions and they enjoyed having somebody to help them with prescription. They felt that after the first and follow-up visit, they just needed a little bit more confidence, and they were happy to be paired up with somebody who was more experienced. We also used and developed an appropriateness of device questionnaire. At the end of the first year, we had fitted 159 beneficiaries, and the original waiting list that the Northern Cape Department of Health had was 140 children. 40 therapists were trained, and we saw that at the follow-up visit, appropriateness of devices had increased in comparison with what the Northern Cape therapists had already originally issued to the clients. Where devices were partially inappropriate, it was because not all the children who were intended for a particular device would arrive on the same day as the seating clinic or the mentored outreach clinic. And because we didn't want the child to go home without receiving anything, we decided that, okay, we can assist you. We'll make the device, we'll make changes to the device and make it as appropriate and comfortable as possible, and then order additional equipment or additional spares as needed in order to make the device fully appropriate. Where devices were inappropriate, we saw that it was because not all therapists from the Department of Health who we were training attended every single training workshop. And because of that, we found that some therapists would prescribe devices that weren't perfectly appropriate according to the SSE clinical team. Okay. In terms of the LTD, the purpose of the LTD was to bring various community members into the same space so that we could acknowledge and determine what the barriers were that people with disabilities, so particularly parents of children with disabilities, were facing in the communities. So we would draw in community members, local NGOs, police, transport sector, social worker, education, to all be in the same room so that we could discuss what was causing the exclusion of people with disabilities and to determine which resources were available in order to assist community members. Key breakthroughs shared were that there needed to be a more formal way to refer, because most clients would be living at home with their child, ashamed because in most cases they believed that their child was affected by witchcraft, and therefore they wouldn't take their child out into the community or out to seek services. They didn't even have knowledge or were not aware that their child needed to seek healthcare services. So the need to formalize referral pathways was definitely one of the main breakthroughs that we had.
I was physically one of the TAS team members who who run this project over a period of 3 years. During the first year, we received a referral from a social worker in the area about a family that really needs support in terms of assistive devices. So on arrival at the house, we found that the mother had an identical twin. According to the mother's information in our subjective assessment, we found that these twins were born on 35 weeks. Both of these twins were RVD positive, and we couldn't really figure out whether the mother attended all the prenatal clinics. They were really staying plus minus 200 kilometers away from the nearest hospital, and the nearest community clinic was plus minus 15 kilometers from their home. According to the mother, she also had 5 other children, which she received a social grant for. The house was very small. It was only a 1-room facility. And during the assessment and evaluation, we also saw that they only had 1 double bed in the house. It was very clear that the children's body alignment was busy to deteriorate. And we did a physical assessment to determine how worse it is and whether it was still correctable. We also found that they never, from the date to birth until that 5 years, they didn't have a proper posture support device. So, but what we found in the house was 2 boxes with 2 Madiba buggies, which could provide a full posture support. But we also discovered that these devices were only delivered in the house without the appropriate adjustments that were supposed to be done to fit them properly. So what we did then, we did the adjustments on the devices and make sure that they were comfortable. The fact that they only, it was very clear that there was really a poverty in that house and in the surrounding. We did another assessment. We used the first assessment findings, and we did a prescription for another set of posture support devices to also accommodate the 24-hour posture support needs. So the first fittings we did was in the posture support devices, as you can see, the Madiba buggies, and then we ordered them a new set of sleeping posture support devices. The fact that we were funded for a 3-year period, we know that we could have included them in this project and make use of the funding that was already that we already had. So the preparations of the devices was done at our company. And so what we did with the next fitting, as we came back with a follow-up in the review sessions, we did a fitting for those 2 devices also. As part of our ongoing support, we also always include the parents in what we're doing, and we make sure that they were familiar with the devices. So we did proper posture support training, product training, and so that they understand how to use the devices, how to maintain the devices so that they can use it effectively. As part of our 24-hour posture support, and then we want to make sure that everything went well until we come 6 months after that.
Quickly to share our key findings. So what we found was that there was a lack of funding to address shortfalls in local government budget for assistive devices. So the therapists told us that when they created their database for children who required assistive technology, once they had issued a wheelchair, they would then remove that child completely off the waiting list. So the waiting list that they were keeping didn't reflect the ongoing costs required by the child. So there was no cost for maintenance, spares, therapist, or technical time in 3-6 months down the line. And therefore, the Department of Health in the Northern Cape's budget stagnated, and they were not able to financially provide provide devices for the true needs of the community.
So the other key findings was the lack of trained rehabilitation therapists available to provide sustainable wheelchair seating services. What we found through all the areas that we work with, that most of them were community served therapists, and there were only a few permanent therapists. So the problem that we received here, every year when the community service therapists leave the hospital or center where they're working, then there was a lack of handover of information. And also this made us, when we came the second year, then you have to start over. So what we then decided is to create a booklet with all the information of all the client findings and clients' needs that we did for the previous day, then we could have used it in that specific year. But this was really an ongoing problem and really make so that our services, sometimes we have to repeat certain things, but we learned our lessons from them and put systems in place to prevent this.
Yeah, so the development of a functional waiting list that also contributed to maintain up-to-date client information and accurately reflect financial needs of clients in communities was very, very helpful as well. The lack of provider or government and client awareness in terms of the referral pathways was also quite a key finding, because there were so many children in the communities who were unable to or unaware that they should and could access government services for support, really impacted the ability of the client to be included in their community, further than just healthcare access. They weren't able to access education. They weren't able to access social services or social activities. So just the fact that there wasn't a referral really impacted the client's life a lot more broadly. And thank you so much.
Thank you so much.
So yeah, hey everyone, I'm Dominic, and I will be talking today about my research, which is on smart mobility vehicles for vulnerable people in public spaces. And hopefully I'll also try to give some guidance or our perspective of what generally is needed to have such a service. So for us, in our research, we work and we are targeting rather people with less disabilities, but lighter disabilities, in the sense that, for example, our target group are rather not people who need a wheelchair at all times, but elderly people who, for example, have problems to navigate through extensive public spaces. So we know that we have more than 1 billion elderly worldwide right now, and with the demographics that we have in Europe and the US especially, this number is going to be growing and growing. These people that we are talking about are people, we call them people with reduced mobility, and the target group that we are targeting is called WCHS. And these are people basically who can still walk short distances, but maybe, for example, already not up or down the stairs. I think what I will be talking about could also apply to people with stronger disabilities and can be adapted in the future to that. Just want to give into context that this is basically the target group that I am working with in my project. So the situation that we are facing right now is as follows, as you can see on this image right here, where we basically have this person on a wheelchair in a very complex environment, and there are multiple problems with this image. So even if that person would try to navigate on their own, of course, that person would face multiple navigational challenges, as this is a complex environment. At the same time, if they try, this is a very high cognitive and physical effort that is required by them. And already we are talking about rather more vulnerable people of our society. And the third point is that, again, even if they try that, even if they have enough cognitive and physical capacity, this would pose most likely increased risk for the user as well as for the environment. And so what we can see right now in those public spaces, such as airports or train stations or hospitals, is that we have this manual wheelchair service most of the times, where basically there are people from the staff that can just come and they provide the service. They put you on a wheelchair, and then they are going to be pushing the wheelchair so you can get to your destination, like, for example, a gate for your flight. There are unfortunately quite a few problems with this approach as well, where the first thing is that this, of course, requires a significant manual labor. Usually it's one person that is pushing one of those wheelchairs. The people that are sitting on those wheelchairs and are getting those service from some people, some people that are pushing them, they don't really have any connection to those people. So there's also definitely this limited autonomy during navigation, and this is twofold. So one thing is that, of course, someone is pushing you, so you cannot steer yourself. But the second thing is that those people that are driving, those people with reduced mobility that are using the service are usually also, for example, embarrassed to ask the person pushing them, hey, I would like to go get a coffee break, or I would like to go for a bathroom break or somewhere else. So usually this also doesn't happen too much. Yeah, which is basically also in this point, what I was talking about right now, that there's this stranger's assistant discomfort where we don't really want to ask people for favors that we don't really know. So the idea for us is that basically instead of having this manual service, we would like to have this assistant wheelchair. So an assistive device service where basically this wheelchair could enable those people in a sense that now the person gains back the autonomy and they can choose where they want to go, but in a responsible way where the wheelchair really keeps them safe. The wheelchair somehow understands what they want to do and just helps them like an assistant would do to navigate them to their destination. This is also something that is a big, let's say, market that really needs, and there is potential for change there because there's also a lot of money, and of course, somehow, usually there's a lot of relation between that. So, for example, in Europe, only the top 10 airports spend more than 100 million euro every year in those services alone for the people with reduced mobility. And so, yeah, exactly, this is what we are doing here. So we are trying to produce this technology and produce this kind of a service where we would be able to just have those wheelchairs in some airports, for example, and then the airports would pay for that. And some people, not necessarily only elderly, but for example, I don't know, you break your leg or something, or you're traveling with someone that has some, let's say, slighter disabilities, then they are able to just take one of those wheelchairs and feel kind of enabled to traverse through those public spaces. And now more to the requirements of like, what does it take to have such a service? So I was talking really, this is more my project that I was talking about right now, but then now I want to go more in general, like, okay, if you want to do something like that, but maybe not specifically for airports, you want to do it something more for personal use, or maybe you want to do something for different spaces, for different target population, what do you have to take into consideration, in my view, in our project view? So the first thing is really this environmental perception. So if you have an assistant, the assistant really knows what is happening around, and the robot should somehow understand in a similar way as a human what is happening around us, and what do I have to be careful of, where do I have to actually pay attention. The second thing is this shared navigation. So as I already mentioned, we really want to enable those people. We don't want to just replace it with some other service, like this manual service with some other service that now will, again, just take it away from them, the freedom, and will just, be very, very strict. So you have to think here about this user safety, comfort, and independence, and somehow they have to, they have to contribute to each other, and somehow all of them have to be guaranteed. And the last thing is that a lot of people are not traveling alone, and a lot of people also maybe feel very uncomfortable in new spaces, and they need still some support. So and maybe they don't feel fine just with a machine, right? And so we also want to, and I think that it's important to also have this possibility to have another person help those people in this navigation. So here, for example, with some kind of a remote control. And so now I'll go to those points a bit more in detail to say how I see them. So yeah, basically for this environmental perception, again, we have a very complex environment that we have to somehow understand. And now we are trying to somehow teach those wheelchairs, those devices with all of the sensors that we have on them, how to understand the environment. And this in turn should hopefully allow us to enable safer and more human-like shared navigation in those spaces. And so here there are like two different types of understanding that we think are important. But maybe first about the sensors that can be used. So we can also, for example, estimate what are the costs. So there are three main types of sensors that can be used for this understanding by a robot, this understanding of what is happening around. One of them is called a 3D LiDAR. So you can see an example output of this. This is what is called a 3D point cloud, where there's basically a laser, which is very quickly scanning at all of those points. And then you get something like a 3D image, just not totally filled like a standard image. Then you have 2D LiDARs, which are a bit more affordable. And with those ones, you get less information because instead of having all of those 3D information, you basically only scan in one of those planes, and then you only get like this one plane view over this. And the other thing is the cameras that all of you most likely know, right? With this twist here that we have an RGB-D camera, so also the depth, where we can estimate how far the objects are from us. So the advantage actually of those LiDARs is that the depth estimation, so the distance estimation, is very, very precise. For the cameras, usually, especially with different lighting conditions, this might be a problem. Okay, so moving on to this environmental perception, now we decided on our sensors, and now we somehow have to integrate them into our system and make them understand the environment. So one thing that we think is important is really this understanding of what is happening more or less now, the dynamics of what is happening now. So you can see here that there is this vehicle, this wheelchair vehicle that is inside of here, and all of those strands around, those paths around that you can see, are people navigating around it. So now, if we understand this, and this is, let's say, this lower level immediate understanding, then we can see, okay, who around us is risk, how can we navigate, what are our possibilities at this moment right now. This is offline, but of course, in the end, what we need is there are people moving around. You can see one person here, another person here, and we need to somehow understand where they are and then appropriately change to this situation. But the second thing which we think is important is like this more global understanding. So, I mean, if I would show you a map, everyone would know what a map is with all of the static obstacles, all of the static rooms and different navigational passages. So that's one thing for the static things, but I think it's also important to have something like that because I think as humans, we really have this understanding of how a space is utilized over time and where usually we can go, where usually maybe there are more crowded spaces where we would like to avoid going. And so that's what we are also trying to do for the device, where instead of only having this low level understanding, we also want to have this higher level understanding, which is a bit, longer in time, not only immediate. So let's say over the next few hours, or maybe over the rush hours somewhere in the airport. So we could understand, for example, where are the crowded areas that we would really like to avoid with those people that are already vulnerable, and we would like them to have as smooth of a navigation as possible, or maybe somewhere where we can join the already existing crowd in order to have a smoother navigation. So that's the first point. Now moving on to the second point. So now we have a wheelchair that actually understands more or less, let's say, we have to somehow, of course, always train it, make sure that it works well, but somehow understands the environment similar to how a human would understand the environment. And now, okay, what do we do with this? How do we actually incorporate it in order to help a person? So what we are using is basically there are these three different types of how we can navigate in this space, how we can assist those people. So there's the lowest level shared control, where basically lowest level assistance in a sense, where we either have a fully manual operation or we just share basically from that shared control between the input of the user as well as the input of the robot. So we give the user, for example, the highest priority, but at the same time, we have to guarantee, of course, that the journey will be smooth and the journey will be safe. So if someone wants to just drive down the stairs, we, of course, don't allow it. Then we have the semi-autonomous mode. So here, as I was saying, this is really for the case where there's another person that is helping, right? And that somehow, of course, the wheelchair should be assisted, but there's someone else that is also helping the person to somehow, adapt to this new environment. And so here we have something like the teleoperation modes, where someone, for example, is holding a joystick and helping this person navigate, or holding some tag so the wheelchair can follow. And in the full autonomy, then this is, for example, for spaces where there isn't so many people, probably not during rush hours, where the wheelchair really takes over, and the person is still in charge, in a sense, like, hey, if they do something, they can always change something. But the idea of this approach is basically that the person can relax and the wheelchair can take over. So now moving a bit more into this shared control. So here, as I already mentioned briefly, so we really want to give those people independence and comfort so that they can do as much as they want, that they really feel in control. But at the same time, as I mentioned, we really would need to prioritize safety. So if someone, for example, wants to drive into me, the wheelchair should really be like, hey, okay, maybe I can get you close to that, but really not driving into someone. So yeah, here the key concepts, let's say, are the obstacle avoidance. This is really like the lowest part, where we somehow really have to keep track, and this is this understanding of the wheelchair, what is around, where are the obstacles, and then somehow partition the control between the wheelchair and the user. This is now about this teleoperation. So right now what we have in our project is basically this kind of a controller, where also, for example, I was talking to some people in this people with reduced mobility service. And for them, for example, the biggest problem is also the fact that right now there's a ramp. There are some people who are a bit bigger, and that they are pushing on the wheelchair, and they have really this physical effort to push this person and get them to the gate where they need to go. And when I was talking to this person that that they could just drive on a joystick, they were already really, like, I don't know, it's rare that I see stars in someone's eyes so much, and they were really, really excited about this possibility where they could just drive someone remotely without having to push hard themselves. And yeah, there are different possibilities. Either there's trained staff, or maybe a companion, or a whole trip guide, if there's a whole trip. Yeah, the plus is here that you have this high level of control with the joystick, but the minus is that, of course, you have to have some training so that people understand what they can do, the staff or the companions can understand what they are doing. At the same time, the other option that we are really thinking of, and I think it's a very good solution, is this thing that we call Follow Me, where basically there is some kind of a tag, there is some kind of a tracker on someone else, and then you don't have to think about, like, how do I want to navigate this wheelchair? The wheelchair should just follow you. There is just something on you that makes the wheelchair follow you, and then this is kind of like this local navigation where I'm just basically following you, right? Yeah, and so this is for this part. And then basically now about the whole project together. So for me, the idea is really like, okay, you have the wheelchair or you have some personal mobility vehicle, and this really doesn't matter so much what it is exactly. And then the thing is that now you have to somehow adapt all of this software and all of those sensors on this vehicle that you have. I mean, it doesn't have to be anything specific, like I said, it's just a platform. And then you have all of those all those three different things that interplay with each other. So you have somehow this situational awareness that somehow has to collaborate with user experience, so the shared control, but also this user experience, basically how you want the user to navigate, has an effect on how you want to perceive the environment, as well as, yeah, with the shared control, how do you want to partition the control between the robot and the human. But I think the most important thing here is that really, if you have a target group, like really specify your target group in the beginning, who you're doing this for, and then really go to them, because the biggest input should be from them. What does it mean for them? What does it mean for them to have a comfortable user experience? What does it mean for them to feel independent? And how do they want to usually navigate? What are their needs in those spaces? And yeah, and regarding the challenges for global implementation, because of course this is also like some technology rather of the future, it's not really implemented anywhere. for now in a public space right now. So especially for the developing countries, it's definitely quite a relatively high cost for even the sensors themselves. So for the electronics, what I think is reasonable for now. I mean, the sensors are getting cheaper, but still I think it's around 3,000 per one vehicle. That has to be that has to be somehow paid by someone. And of course, you also have to have the wheelchair itself that is needed. Another thing is that, of course, in many places, there is no even available infrastructure for such a service in public spaces. So maybe it's not a problem somewhere in the US or in Europe, but in many places, maybe there is no place to, to have elevators or mostly smooth surfaces. So there are no big steps, and you still have those limitations with most wheelchairs. Another thing is that, of course, the more complex the wheelchairs are becoming, the more complex is the maintenance, the hardware replacement. And so you have this additional training for the staff in order to have the service be, so you can maintain the service and not just have it for 6 months and then something breaks and you cannot do anything about it. The good thing, I think, is that, especially on the software side, really, you don't need someone who will invent something new. You don't need to really reinvent the wheel with a lot of the software. You still need someone skilled in order to imagine having Lego pieces, and then you just have to put them together in a skillful way in order to have something great, but you don't have to make the Lego pieces themselves. So at least on this side, I think, because I think it's really a great thing to have people from the countries. That's the thing, if you want to, for example, reduce the cost, and I also was hearing it from Michelle during the Ghana workshop that we both attended, that basically if you somehow make those people and the companies within the countries try to develop the services themselves and the solutions themselves, it usually also lowers the cost that is required in the end for such a service. And that's basically most of what I wanted to talk about. And so basically, I think that really there's future for these kinds of smart solutions that we are developing. But of course, you have to take into consideration a few of those different things, like make sure that somehow the robot understands similar as people understand. You have to give really this independence, but at the same time safety to the people that are driving this in this service, and at the same time somehow make it possible for other people to contribute to the assistance, to make other people feel help them with adapting to this new situation. And most importantly, just really whatever you're doing, whatever service it would be, whatever space, whatever kind of country, just make sure that you define your target group and that you go to them and you talk to the potential users, so that in the end, it's not like you develop something and no one can actually use it, but you wanted to make it work. So that's all from me. Thanks a lot. And I will be ready to answer some questions later, I guess, after the next presentation.
Thank you, Dominic. Again, if you have Q&A, a question and answer, please drop it in the Q&A and we'll take them at the end. Just wanted to go to our last speaker for this session. Krithika, if you could go ahead and give your presentation.
Sure, thank you so much. Firstly, I want to thank Maria and Ronique for the great presentation on Northern Cape. It was very interesting to learn so many things. And thank you, Dominic, for presenting on your various innovations. Just fantastic to listen to. So my name is Krithika Kandawale. I am the program manager for the International Society of Wheelchair Professionals. We are a nonprofit organization based at Pittsburgh, USA. And we are a USAID funded grant. And we've been around for a decade now. So initially, we received a grant from USAID at the University of Pittsburgh. And then last year, we moved out to be our own separate nonprofit organization. For those who missed the introduction, my background is in computer science and engineering, and I have a Master of Science in Knowledge Management. So today, I'm going to walk you through our organization, some of the resources that we've developed, especially for standardizing products, services, and training. Like most of you in the webinar already know, there are more than 75 million people worldwide who need wheelchairs as per the World Health Organization, but only 15% have access, and the access is even more limited to wheelchairs and services in less resourced environments. So our mission is to empower wheelchair users and their families by being the global coordinator of the wheelchair sector. Our vision focuses on wheelchair users and their families have access to appropriate wheelchairs and services within an empowering and supporting environment. And we recently elected a 15 board of directors who oversee all our activities. And we have a database of over 9,000 members who come from various sectors like clinicians, physical therapists, occupational therapists, prosthetics, orthotics, doctors, nurses, wheelchair users, of course, and their families, and not to forget manufacturers, suppliers, and nonprofit organizations. We have 5 standing committees focusing on various pillars that we work on. And these committees are made up of hundreds of volunteers who are supporting to develop standards and trainings. So this is the World Health Organization's 5 P's of assistive technology. So what we've done here is that we've taken each of them and developed products and resources to support appropriate wheelchair services in low and middle income countries specifically. So with regards to products, we have testing, drawings, available testing, design consideration documents for wheelchairs in adverse conditions. So for example, if your organization would like to develop a testing center, so we have recommendations on how to do so based on the conditions that's possible in a low and middle income setting. We also have a products wiki where engineers contribute to some of the testing methods. It's all freely accessible on our website. We also have a community of practice for testing centers globally. So this is like a community of practice that they come and meet virtually every other month, bi-monthly, and they discuss some of the challenges in their testing methods and how they could improve and some of the lessons learned. So others could also implement and learn from them. And with regards to personnel, we've developed online courses based on the World Health Organization's wheelchair service training packages at the basic and the training of trainers level. We also have stackable certification, which I will be talking about in a minute. And again, a community of practice for academic training partners. So these are educators who are trying to integrate wheelchair content into their curriculum. And so they come together to share the lessons learned and how they could help others to also integrate wheelchair content into their program. This could be professional or any training program. And we also recognize courses that have wheelchair content as per the World Health Organization standards. And we also recently developed another resource called the Wheelchair Educators Package, which is linked to the academic training partners. So it's like a one-stop for educators who are looking to integrate content into their curriculum. So if, for example, if you want to integrate a case study of like pressure sores or ulcers, we have case studies, like activities on how you could do so to present to your students, and how do you evaluate them, how do you evaluate the program, and so forth. So like all the resources that you could possibly think of is available for free to access at the Wheelchair Educators Package website. And you could access all of these resources using the QR code that's on the screen. With regards to people, we have made several advocacy efforts in the last decades. We have also strengthened research. So all our products that I'm talking about right now are research-based. So we have several publications and pilot tested methods that we've adopted over the years. Just recently, last year, we collaborated with WHO, the World Health Organization, and the ISPO, the International Society of Prosthetics and Orthotics, to update the WHO standards for wheelchair service provision. I'll make sure to drop the link for this resource in the chat right after my presentation. And so this is one of our recent product release. With regards to policy, we also have a policy advocacy kit, which has several case studies to advocate for governments to integrate or change their policies to include wheelchair products and standardized services. So one such impact that we created recently was in Colombia, where we the wheelchair service providers in that country will need to go through or receive ISWP's certification at the basic or intermediate or the trainer's level in order to provide wheelchair services, which is a huge win for us. So the legislation is still being passed. Like I said, we focus on 3 pillars: the advocacy, training and education, and the product standards. And we make sure all our products and all our services are based on evidence-based. And so this is the wheelchair provision guidelines that we collaborated with WHO and ISPO. And this is a picture from the launch event we had in 2023 at the 19th World Congress, ISPO's World Congress in Guadalajara, Mexico. And what you see on your screen right now are some of the product standards related to the testing that we have developed over the years. So we have a caster testing, which has been recognized by ISO. This equipment is actually available for testing in our basement lab at the University of Pittsburgh. And then we also have corrosion testing, brush testing, the rolling resistance testing at LeTourneau University, our own PITS previously. So I was based in University of Pittsburgh, so I still have our own, but University of Pittsburgh's rolling resistance testing, free wheelchair missions, whole wheelchair test track. And this is the products wiki. So this is how it looks like. So all the technical stuff that you need, for example, ramp, like what kind of measurements you need to have. If you need to have your own testing labs, like all the measurements that you need, what kind of materials you need to build your own testing lab, everything is available on our products wiki. And it has been tested and has been shared with us by partners who actually have their own testing labs. Over the years, we also developed caster failure checklist, and we also have test drawings available on our website. And so this is the stackable certification that we've developed. So we have a basic, intermediate, and trainer. So the purpose is to raise global awareness of professional standards in wheeled mobility and seating. The advantage of having such a certification is that it supports professional development through exclusive access to CE opportunities. And we have over 250 plus certified providers from 32 countries. And they'll be listed on the website as certified wheelchair providers. So for example, if you are looking for certified service providers in another country, you could easily find them on our website once you become a member, and you can get in touch with them. So that's one of the benefits of having the certification. And yeah, that I kept it short because I know we're have a time limit. So the call for action is that I would like to invite everybody on this call to join our global network for free and to access all the resources that I mentioned in my presentation today, which is free until the end of 2024. Because we are a nonprofit organization moving into 2025, we are going to move into a membership model. So we will be charging for membership from 2025, but until now, until the end of this year, all our resources are free to access, and you can access them using the QR code here. And please do support our initiatives and follow us on our social media platforms. Thank you, everybody. Please feel free to share your questions in the comment.
So if everyone could join back, and then Rochelle, my co-host, will field questions at this point. If everyone could come back on, video wise, so that we could have like a panel discussion. Rochelle?
Yes, thank you so much to our speakers for for this wonderful talk. It's been absolutely illuminating. We have a couple of questions from some of our participants. One question has already been answered, but from Carol Walmsley. So Dominic, this might be for you, where it says fabulous work. So several years ago, her clinic had an individual who was blind and did not walk. At that time, they were looking for a device sensor that could detect her environment so she could use a powered wheelchair. We did not solve her problem with low-tech efforts. Do the sensors and teleoperations system interface with current powered wheelchairs and power add-ons for wheelchairs?
Yeah, so the one problem is unfortunately that I am not aware of like providers of the whole system, so that someone would really come and install, for example, the sensors, and then they would guarantee that, hey, this is going to work for this person and it's going to be that is going to be, you know, safe. So the thing is that I am pretty sure that the technology right now is good enough. And the sensors that I was presenting, especially the 3D LiDAR sensors, if you want to have some knowledge about the environment, but also guarantee safety because the distance is very precise, I think they're a very good choice. For the teleoperation, I mean, this is rather not a problem. I think yeah, that's the thing. You just really need something like a joystick, some kind of, and then it's quite easy to hook it up to some kind of motor system that you have on the wheelchair. So for powered wheelchairs, this shouldn't be a problem at all. The biggest problem is right now really that there are no providers who would just be like, you can call them and they'll be like, okay, I come, I install everything, and then I guarantee that it's going to work. So probably this work somehow has to be done by someone, this consolidation of effort to have this really working.
Right, right. That's great. And then I think maybe a follow-up to that question is, did you consider any collaboration of the wheelchair sensors and teleoperation with a wheelchair company such as Permovale, which is a global company based in Europe? Go ahead.
So we are working, so basically I'm working on a like innovation grant project in the academia in Switzerland. So we are working with a startup company, which is called DAAV, D-A-A-V. And yeah, basically they provided us with the wheelchair chassis. So we can then develop the technology. And at the same time, they provided us with the possibility to go to the airport in Zurich and to actually test there what we come up with. So yes, we are partnered, and this is definitely somehow intended to not only stay in the research, to really somehow push it into the public space.
That's great. That's great. And I know Maria and Ronique, you answered this question already, but maybe you could describe a little bit so that our audience can hear about it too. You know, you talked about the terrain of the Northern Cape, but what challenges do individuals using wheelchairs face navigating this terrain, and how do therapists assess and manage this?
Yes, I think South Africa definitely has different types of peri-rural to rural terrain. Mostly in the Northern Cape, it's mostly sandy gravel type terrains, and we're finding that larger rear wheels are often a lot easier to overcome the terrain, and then definitely thicker casters. So within our government system, there are particular specifications that all wheelchairs must meet and certain standards that they must meet before they can be accepted into local healthcare institutions as appropriate assistive devices. So therefore, whatever wheelchairs are donated or are ordered must be ordered from the national tender and must meet the tender specifications in order to qualify as an appropriate device in South Africa. Therapists, in terms of assessment, because the terrain is so varied, it will definitely differ, and I feel that the only way to test and to find out whether something is an appropriate solution is to actually have the person push it on the terrain itself and see how they manage it. So to actually have a physical test.
That's great. That's great. Thank you.
Okay. Good.
Just any other questions from the audience? Or Michelle, do you have a question?
1 second. Sorry. I actually do have a question. Can you hear me?
Yes.
So I was curious about a couple of things. You mentioned this might be for Ronique and those guys. You talked a little bit about repair and maintenance. And I was wondering, in terms of this training, where are there engineers or technicians or other types of disciplines involved in terms of this type of work? And because I think of, what Dominic's doing, and there's a lot of work on kind of innovation within wheelchair spaces. How, maybe if there aren't, like, what is the kind of route forward to make sure that the engineers or technicians are involved in that process?
Because we are a manufacturer, we do of course have a design and engineering department. Our technicians are trained by them, through them, and upskilled so that they are able to assess, repair, and maintain Shown-equipped devices. But then also we encounter so many other devices in the field that they are quite thoroughly upskilled to maintain more than one device. And because wheelchair technicians is such I almost want to say scarce resource in South Africa, we've developed a training program that helps, where our technicians actually help to upskill and train technicians that we identify through various projects. Yeah, so we do a lot of skill sharing to ensure that the knowledge isn't just held with us, and that government departments and local communities can move forward and sustain the services, themselves.
Do you have a relationship with the Kasika? Because it feels like maybe to get more of the technical folks involved might be interesting, and being able to train them in that resource as well. As curious.
Yeah,
We know each other well.
Yeah. So Shauna McDonald from Shown-equipped actually sits on our board.
Oh, okay.
And she's instrumental in providing her great guidance for many of her activities. And Ronique and many other of her colleagues are actually certified trainers from us. So we are in a great relationship, and yeah, we share information with each other to keep us informed.
That's wonderful.
That's fantastic. And I guess we'll take one more question. So regarding the terrain, are there any considerations to add a low-cost pathway, such as tiles, recycled tiles, or upcycled from trash, or tiles upcycled from rubber? It could impact wheelchair maintenance costs.
I must be honest that we haven't particularly explored how to upcycle wheelchair spares from previously owned ones. So I think we definitely do try to reduce waste by upcycling our existing products, refurbishing them, cushions, covers, new wheels, new casters, so that the device doesn't go to waste and it can actually be used by another person. So that is what we're currently doing, but I actually haven't explored any upcycling through recycled materials. Yeah.
Great. I think that might be the end of our questions. Michelle, you're muted.
So it's the end of our questions, but I wanted to just make sure that everyone is aware that we will be back again July 17th, and would love your participation. We thank you, our speakers for today, and learning about wheelchair globally, and some of the challenges, and also some of the futures, and some of the things that people are doing to make this process easier for wheelchair users. Thank you for that presentation, and we'll see you guys next month for our seminar. We'll shift to infants and talk a little bit about clinical perspectives and some use of technology there to try to support infants or identify those at risk very early in their process. Thanks again, everyone, for joining us.
Thank you, everyone.
Thanks a lot, everyone.
Thank you.
Thank you.
Thank you.